anesthetics. So for that subject, you will have a thorough discussion on kinetics of drugs. Okay, so focus lang sa review on pharmacodynamics. Another thing, it is a must also no, to review the principles of pharmacodynamics. Kasi if you recall, di ba, when we say pharmacodynamics, okay, this is it has something to do with the effects of drugs. Di ba? In operational term, it talks about what the drug does to the body. So yan yung operational terms in order to easily understand pharmacodynamics. Now, that is actually the heart of pharmacology. Okay? Di ba sa pharmacology, it is all about drugs. So we study the mechanism of action ng drugs. Pag sinabing MOA na kasi ng drugs, yan yung pharmacodynamics all about. Okay? Kasi sabi sa pharmacodynamics, what the drugs do to our body. Ano ba yung ginagawa ng drugs to our body? Di ba nagpo-produce siya ng response, nagpo-produce siya ng effect. How? Meron siyang certain mechanism of action na pinoproduce. Now, talking about mechanism of action ng drugs, there are actually two major ways how a drug produces its physiological effect. Again, when we talk about MOA of drugs, there are two major ways how a drug produces its physiological effect. Meron tayong mga drugs that are protein targeting, meron din tayong mga drugs na non-protein targeting. So later, on the latter part of our discussion, you'll get to realize what are those examples of drugs na needs to bind on the active site ng protein para makapag-produce ng effect, and those drugs, examples ng mga drugs na hindi na kailangan mag-bind sa active site ng protein, but they still produces an effect. So let's start with the definition of terms. One slide lang tayo for definition of terms. Let's start with pharmacology. So again, pharmacology, this is all about drugs. It studies the biological, physiological aspects of drug effects. And that includes the ADME. Ano ibig sabihin ng ADME? Absorption, distribution, metabolism, and excretion. So dito papasok yung pharmacokinetic. Okay, pharmacokinetic. Diba? Pag pharmacokinetic, yun yung ADME. Okay, what the body does to the drug. Okay, yan yung pharmacokinetic. Toxicity, okay, that is also part, no, of the aspects na inaaral natin sa pharmacology. So ito yung, dito papasok yung toxicology. Okay, and lastly, specific MOA of drugs. Ito naman yung pharmacodynamics. Okay, so pag pharmacodynamics, MOA, mechanism of action of drugs, yung effect, yung specific effect, ng drugs. Now, talking about the heart of pharmacology, diba? Let us now define what is drugs. Okay. Now, drugs in general, these are any agents, any substances that are able to alter, they are able to modify the body structure and the function. If you try to recall the definition of drug in your DDS na subject, di ba na at a USP definition ng drug sa DDS na book, sabi doon nga ang drugs, these are any agents, any articles used in the medication, diagnosis, prevention, treatment, and cure of diseases. So that is all about drugs. Okay, so you can just read this. Pag sinabi namang poison, this could be any chemical agent that produces harmful effects. Pwede yung harmful effects is in a form of injury, in a form of diseases, or it may even cause death once introduced inside the body. Okay, yan yung poison. Example, in our, if you recall, no, sa inorganic chemistry, I have mentioned to you that there are metallic poisons. Okay, example are arsenic. Okay, yung lead. Okay, these are metallic poisons, and I want you to take note of this basic knowledge that all the drugs in high concentrations, they become poison. So I think you're all familiar on this thought, okay, or this idea. Okay? So any patients kapag binigyan mo ng higher concentration ng drug, okay, higher than the regular dose dapat ng drug that is intended dapat na ibigay sa kanya, so that might cause adverse effect, that might cause side effect, that could be harmful, no, sa safety ng pasyente. Okay? Then, lastly, we also have this specific poison. Kapag ang isang poison naman is of biological origin, ibig sabihin naturally produced siya by a certain living organism. Example, it is being produced by a bacteria, it is being produced by an animal, or being produced by a plant. So natural ang iyahang origin, then that is a toxin. Example, tetrodotoxin. Tetrodotoxin, this is a toxin that is found in the liver of some fishes. Example, sa pufferfish, yung toadfish, sa ilang liver, okay, it produces tetrodotoxin. Another example, sa plants, yung mushroom, di ba ang mushroom na siya toxin? Okay, yung toxin, yung mushroom toxin, we have yung amatoxin. Okay, and there are a lot of mushroom toxins na which are really poisonous. Okay, so again, for the definition of terms of pharmacology, is all about drugs. Okay, the heart of pharmacology, kapag drugs, ang inyong yung termi, hunahunaan kapag drugs, it is able to alter, it is able to modify the body's function. Okay, poison, in general, any agent that could harm a human or an animal. Then toxin, it is also a poison, but of natural origin or of biological origin. Okay, now let us proceed to the branches of pharmacology. So, there are again two primary branches of pharmacology. So, una, we have pharmacodynamics, then pangalawa, pharmacokinetics. Now, I added here pharmacotherapeutics because somehow this is applicable also in our field in pharmacy. So, later I will define pharmacotherapeutics. Now, going back to pharmacodynamics in operational term again, para madali lang matandaan, okay? In operational term, pharmacodynamics, this is what drugs do to the body. Okay, ano ba yung ginagawa ng drugs once ma-introduce siya sa body? Okay, di ba it produces a certain effect. It alters, it modifies the body's function. Okay, nagpo-produce siya ng response. How? Meron siyang specific mechanism of action na pinoproduce. Okay, yan yung ginagawa ng drugs to our body. That is all about pharmacodynamics. Pag pharmacokinetics naman, kinetics, in operational term, this is what the body does to the drugs. Ito naman, ano yung contribution ng katawan natin kapag yung gamot nasa loob na. Okay, nasa loob na natin. So, ang contribution ng body, okay, is for the body to absorb the drug, for the body to distribute, di ba, the drug to the active site, okay, to the site of action, okay. Ang body then, it will metabolize para ready na for excretion yung gamot. But for some other dosage forms, like solid na mga dosage form, dili man diretso absorption, di ba? Yung ginagawa ng katawan na apay liberation. Okay? So liberation, una, there are also drugs na mo undergo og reabsorption after excretion. Okay? So these are all part of pharmacokinetics. Sige lang, you will learn this, Ladmer. Okay, you will learn this. Ladmer ni siya iyahang mnemonics. Ladmer. Okay? This will be discussed to you sa biopharmaceutics and pharmacokinetics. Okay? So again, for pharmacokinetics, ano yung ginagawa ng katawan, ng body, towards the drug. Okay? So it talks about the fate, yung destiny ng gamot, okay, inside our body. So ladmer, yung destiny ladmer, ma-liberate ang active pharmaceutical ingredient if it is a dosage form. Then kapag aqueous solution na siya, ma-absorb siya, then na-distribute sa site of action, metabolize, then excreted. And for some other dosage form, again, they might be reabsorbed back to the blood. Next, pharmacotherapeutics naman. Pharmacotherapeutics, this is all about pharmacotherapy. From the word therapeutics, so nyo halang tandaan, therapy. Okay, therapy. So it has something to do with the rational use of drug, yung management, yung intervention ng disease. Okay, this is very important, no? Dito kasi papasok yung rights of medication administration, di ba? If you recall the rights, pila mo to ka rights? 7 or 6 rights na dapat na to i-take note. As pharmacists, we must make sure to dispense the right, drug, okay, with the right dose, okay, to the right patient, okay, at a right time. Okay, with the right route of administration. Okay, so dira mo sulod ang pharmacotherapeutics, yung proper na management, okay, pharmacotherapy sa disease or condition. Okay, diri inyong application kung naay ihatag na patient case study lugar. Okay, dito papasok yung mga treatment algorithm, yung application nyo, okay, on your knowledge sa drugs. Kasi if you know already this, pharmacodynamics, master na ninyo ang MOA ng drugs, master na ninyo ang kinetics ng drug, madali na lang yung pharmacotherapeutics. Okay, application naman siya sa two primary branches ng pharmacology. Okay, maghatag ko example. Say for example ba, ang patient na siya UTI, okay, urinary tract infection. As prescriber, as medical expert, dili ko mo diretso og drug of choice na akong ihatag. Okay? So muna siya ang pharmacotherapy, dili ko diretso okay, ang drug of choice, magsalig din diretso sa drug of choice. No. Tanawon yun as medical expert, tanawon yun, studihan yun ang pasyente, studihan ang iyang PMH, iyang patient medical history. Okay, so dira masulod ang patient-specific factors, studihan po ang iyahang mga comorbidities, iyahang mga concomitant ng mga medications na ginatake, recently ginatake, or previously ginatake. Okay, so say for example na siya UTI, then magsalig ka sa drug of choice. Okay, ang drug of choice kasi for UTI, sige, anyone, kung saan drug choice sa UTI, diba naman mo na siya, microbiology. So say for example, you have ang patient, okay, positive na siya UTI because of the presence of E. coli sa iyahang urine. Okay? So, let's say for instance, resident doctor. Kanang mga resident doctor, mag-iusahay kay diretso sila sa kanang mga broad spectrum ng mga antibiotic, diretso sila sa drug of choice without knowing the naay nga ng resident doctor, especially now, kanang magdali na, okay, emergency cases. Na karon ang gihatag is, gihatag niya nga treatment is yung drug of choice, which is yung brand name na Bactrim. You can search sa internet kung saan generic name ng Bactrim. It is a combination of trimethoprim and sulfamethoxazole. Okay? Now, kana nga drug, very good siya to treat UTI. However, dili man sa tanan patient hiyang siya anak nga drug. What if ang patient na ay hypersensitivity? Okay? what if. Okay, so sensitivity. Okay, so what if lang na siya hypersensitivity. Another, ang patient is pregnant. Okay, i-consider na siya no, pregnant siya no women. Okay, kani si Bactrim contraindicated na siya. Okay, sa patients with hypersensitivity, patient na pregnant. Kasi nga, you can search ha, meron siyang sulfonamide. Di ba, anak ko, combination siya sa trimethoprim o sulfamethoxazole. Yung sulfamethoxazole, that is a sulfonamide. Okay, isa yung sulfonamide. Ang sulfonamide kasi, isa sa iyang mga contraindication is bawal siya sa mga pregnant women kasi nga nagpo-cause siya ng hypersensitivity reaction. Okay? So, pwede sumusamot, no? Ang current na comorbid sa pasyente. So, yung ana, dira mo sulod ang pharmacotherapeutics. That's why very important nga aralin niyo muna yung dynamics, kinetics, because that's the time kung very master na mo sa dynamics ng drug, kinetics ng drug. Pharmacotherapeutics is just so easy. Kaya application na lang man siya. Okay? So daghan sa inyo, I know daghan sa inyo gusto mag-proceed of medicine. So please be responsible no kung mag-pharmacotherapy na mo sa pasyente. When you manage the disease, the condition of the patient, you really have to study. Then, kung inyong lang tawon, di ba, antibiotic man to. Antibiotic man ng Bactrim. Okay? Kaya di ba, ang atong gina-counteract is E. coli. E. coli is a bacteria. Okay? So kung antibiotic, di ba, very rampant na kayo ngayon ang antibiotic resistance. So kana, i-consider po na siya in a hospital setting na sila yung mga policies to steward no, antibiotic resistance. So inga na. Okay? So yan yung branches ng pharmacology. Then, okay, so as I mentioned earlier, we will, time na. What time get mag 4:30. I'm sorry. So, pharmacodynamics. So, I will give more focus sa pharmacodynamics as I mentioned earlier. So, by definition again, it studies the biochemical, physiological effects of drugs in the biological system. And it also studies the mechanisms of the drug's action. Now, upon reviewing the principles of pharmacodynamics, we will follow this outline of topics. Okay? So somehow, yung mga under sa akin sa Pharmacology 1, so more familiar na sa inyo kanina slide. Yes, more gihapon yung akong i-discuss, but na lang siya yung mga addition, mga supplements, okay, or mga other examples. Okay? So, we will start with the mechanism of action, yung dalawang major ways how the drugs produces effects. Pwedeng ang drug protein targeting, pwede din ang drug non-protein targeting. So we'll start with those drugs that are protein targeting. Ibig sabihin, they could mediate, they could produce response upon binding to the active site ng protein. Okay? So, I repeat, when we say target protein mediated, it is a specific way or specific mechanism of a drug wherein a drug is able to provide a response or produce a response upon binding to the active site of the protein. Now, what are examples of those protein na tina-target ng drug? So there are actually two types of protein in general. So una, let me introduce to you structural proteins first. So maghatag kong example no, ng structural proteins. But what are structural proteins first? So from the word structural, so structure, these are very important proteins that maintains the framework. No? It maintains the shape of the cell. It maintains the skeleton of the cell. Okay? In fact, structural proteins, these are present, okay, in the structural elemental composition ng mga cartilage, okay, ng bone. So, very important siya for the structure, for the framework ng cell. So, halimbawa ng structural protein, specific example ng structural protein, we have microtubules, tubulin. I repeat, specific example ng structural proteins, we have microtubules and tubulin. Microtubules and tubulin, these are very important in the following processes. Important sila for mitosis. Di ba mitosis, yan yung isa sa mga way of cell division ng cells. Okay? Cell movement, very important din itong mga structural protein na to. Then, for the axonal movement of neurotransmitters. Ngayon, there are few nga mga drugs that targets structural proteins, okay, in order to produce their effects. Okay, halimbawa, we have vinca alkaloids. You're familiar, di ba, with alkaloids. Saan man siya ma-encounter ang alkaloids? Sa mga plants, sa pharmacognosy. So, halimbawa ng vinca alkaloids, yung vincristine. Another example ng drug is paclitaxel under the brand name Taxol. Okay? So, vinca alkaloids, like vincristine, paclitaxel, these are actually anti-cancer drugs, anti-neoplastics. Pero tingnan, sa presentation, halimbawa daw sila ng drugs that targets structural proteins in general. So let me explain to you how these agents are classified as protein targeting drugs. Okay. Now, let us have first a short na pathology on cancer. Okay? Kung ang patient may cancer, we're talking about cancer cells in general. Ang cancer cells, isa sa ilahang mga property is that they rapidly proliferate. When rapidly proliferate, they rapidly divide and then multiply. They divide and multiply. Diba? They like to divide. They love to divide. Muna siya ang cancer cells. Paspas kaayo ang ilahang rate of cell division. And one way of cell division sa body natin is, diba, what we call the process mitosis. Therefore, for cancer cells, mitosis is an important process para mag-divide sila at a faster rate. Okay? Now, ano yung structural protein, okay, na very important, okay, or involved in mitosis? Diba, we have microtubules. Diba, sabi ko kanina, microtubules, tubulin, these are structural proteins very important for mitosis. So, very important for mitosis are microtubules, okay, tubulin. These are structural proteins involved in the process of mitosis. Dito ngayon papasok yung gamot na vinca alkaloids, vincristine. Okay? So, vinca alkaloids, vincristine, these are anti-cancer. How? Unsa nila pagka-categorize as anti-cancer? Anti-cancer sila because they have this mechanism of action na they are able to destabilize. Okay? They are able to destabilize microtubule. Okay? In short, mga anti-microtubule ang vinca alkaloids tsaka paclitaxel. They target microtubule. Okay? So, given this idea na anti-microtubule ang vincristine paclitaxel, anti. They destabilize microtubule. Therefore, non-functional ngayon yung microtubule towards mitosis. Pigil yung mitosis, pigil ngayon yung cell division ng cancer cells. That is why anti-cancer yung vinca alkaloids and paclitaxel. Kapag tinanong kayo anong klaseng way yung response ng or yung effect ng alkaloids and paclitaxel, is it protein targeting or non-protein targeting. So isa siyang protein targeting kasi it targets microtubule. Anong klaseng protein? Structural protein. Kasi microtubule is an example of a structural protein. So that is the reason why isa sa mga example that target structural protein yung alkaloid saka paclitaxel. Okay? So another example, we have colchicine. Colchicine, this is also another drug that is considered protein targeting. Particularly, it also targets structural protein. Okay? Now, ano ba yung colchicine first? Colchicine, this is the first line agent in the management of acute gout. Okay? So, para mas maintindihan, okay, yung MOA ng colchicine, let me give you the pathophysiology first. Very short lang. Pathophysiology ng gout. Okay? So, talking about gout, sa manang gout. Yung gout, ang usual na manifestation sa pasyente, no, na mayroong gout is una, mataas yung uric acid level. Okay, mataas yung uric acid level niya sa blood. Yan yung isa sa mga manifestation. Pag taas din ang uric acid, taas than the normal ha, na siya gout. Okay, ang patient. Another thing, isa itong ma-observe sa mga patient na may gout, na siya pain, felt, diba? Unsymmetrical pain being felt by the patient. Usually, ang affected, diba? Ang common na pain felt by the patient is yung sa big toe, pero other areas, okay, surrounding that joint might also be affected. Example, pwedeng during gouty attacks, sakit ang wrist, sakit ang fingers, sakit ang elbows, sakit ang tuhod, ang knee, okay, yung toe, sakit. So, unsymmetrical siya. Okay? What is the reason? That is because of the movement, okay, of inflammatory cells. Okay? So that is the reason bakit merong unsymmetrical pain being felt by the patient na merong gout. Nagkakaroon ng movement of inflammatory cells. Okay, so these are common manifestation ng mga patients with gout. Ngayon, yung pain being felt by the patient, yung pain sa big toe, sa mga joints ng patient, ang contributing factor doon is itong second bullet. Okay? Bakit may pain being felt? Okay? It is because of this movement ng inflammatory cells. Doon papasok ngayon yung colchicine. Okay? Dito papasok yung colchicine. Before that, ano yung sabi ko kaninang na very important structural protein for the movement of cells? Diba? We have, again, microtubule, tubulin. So most especially, tubulin is one of the structural protein that is very much involved sa movement of inflammatory cells. Okay? Ngayon, pag pinasok na si colchicine, yung gagawin ni colchicine po as an anti-gout, it simply depolymerizes tubulin. So again, it targets tubulin. Okay? So iyahang ginatarget ni siya ha. Okay? So iyahang ginatarget ang tubulin. Okay? Now, upon targeting tubulin, okay, upon depolymerization ng tubulin, so non-functional na ngayon ang tubulin for cell movement. Okay? Targeting tubulin will cause pigil ng cell movement. So, pigil yung cell movement. So, kumusta yung pain being felt by the patient? So, somehow, ma-alleviate ang pain. So yan yung ginagawa ng colchicine as a first line in the management of acute gouty attacks. Kasi during acute gouty attacks, sakit din ang pinaka manifestation or clinical manifestation na being felt by the patient. Okay? So muna siya ang first line agent. Now, my question is, do you think colchicine can also lower the uric acid in the blood? With that MOA niya, di ba yung mechanism of action daw niya is to depolymerize tubulin. Do you think kaya niyang i-lower yung uric acid? No. Okay, very good. Wala siya activity towards lowering or reducing uric acid sa blood. Wala. Zero. Kaya nga, kapag ang colchicine is given, naapod na siya combination drug. A combination drug na anti-gout pa rin, pero yung anti-gout na yun can lower the uric acid. Halimbawa, this is usually given with allopurinol. Okay? Allopurinol, this is also an anti-gout, but this time it can lower the uric acid in the blood. Okay? So, ayan. So, please do remember ha, yes, first line lagi siya in the management of acute gouts, pero wala siya activity to lower uric acid. Yung activity lang niya is toward tubulin, depolymerization ng tubulin. So, question, colchicine is is colchicine a protein targeting drug, yes or no? Yes, okay. Protein targeting siya. Kasi nga, tubulin is a structural protein. Okay? So, yan. So, these are few examples of the drugs that targets structural protein. Now, another example, ayan. Another example is griseofulvin. So, ganun pa rin, griseofulvin. It is an antifungal. Antifungal siya, then yung action naman niya is, ayan, it inhibits mitosis, fungal mitosis. So, ganun din. Ano ba yung mga, di ba, may mga structural proteins that contributes for the process mitosis. So, as an antifungal, iyakang gina-inhibit probably yung mga structural proteins to inhibit fungal mitosis. So, griseofulvin. So, again, these are the few lang niya siya halin na kumahatag tanan. At least, di ba, inyuhang realize, ma-appreciate na there are few drugs that are protein targeting, particularly they target structural proteins. Okay, let us proceed to the second type of protein, okay, wherein a drug could bind to its active site, then producing a response. So we have regulatory proteins. Ang mga regulatory proteins naman, via its term itself, diba, regulator, sila yung nagre-regulate ng cell activity, ng cell function. Okay, so there are actually 4 types of regulatory proteins. Okay, so katong sa outline na akong hatag previously, katong previous na slide, diba, under regulatory proteins, mayroong 4. Una, we have a voltage-gated ion channel. Pangalawa, we have carrier molecules. Pangatlo, we have enzymes. And pang-apat, receptors. So we will start with voltage-gated ion channel. I repeat, a voltage-gated ion channel, isa po siyang regulatory protein. Again ha, isa siyang regulatory protein. So there are drugs ulit nga protein targeting din, but this time they target a regulatory protein. They target a voltage-gated ion channel. Now, voltage-gated ion channel, these are ion channels that conduct changes in electrical signals. So, halimbawa nito, familiar man siguro mo no, sa potassium ion channel. What else? Sodium ion channel. Okay. Calcium ion channel. Kana sila. Okay. So, those are examples of ion channels. Okay. Now, by definition, we can easily describe what is an ion channel. Okay? So kung ato siyang i-mano-mano o describe ang term, kung yung kag-channel, channel, di ba? Pag channel, this is a way, a passage. More siyang passage na passage. So daanan, more siyang daanan. No, kinsa man ang mo pass by on that channel. Ano sabi dito? Ions. Okay? So natin mga ions. Halimbawa, potassium ions, sodium ions, calcium ions. So pag sinabing ang ion channel is potassium ion channel, therefore, ang ion nga mo pass by, okay, is of course potassium ion. Okay, so depende na siya unsa na siya ion channel. Okay? Now, I will give an illustration para dali lang masabtan ang function ng ion channel. Halimbawa, let me extract a sodium ion channel. Okay? Sodium ion channel. By the way, kung may ion channels, these are actually embedded in the cell membrane. Okay? So if I will illustrate it, for instance, you have this sodium ion channel. This is the inside of the cell. Ayan. Inside of the cell membrane, it's outside of the cell. Okay? So, itong gate na to, so close pa, close. So, this is a sodium ion channel. Sodium ion channel. Okay? Now, ngayon, at a resting state, kanang normal ba? Normal na state, normal resting condition. Kapag ang inside ng cell highly negative or negatively charged, normally negatively charged, ibig sabihin yan, resting state ang cell. If nasa resting state, normal condition na siya. Normal condition ng cell. Okay? That is why yung sodium ion channel, syempre, nasa outside of the cell. Nga nasa outside man, if you recall the mnemonics PISO, nadumduman ba ni sa inorganic chemistry? PISO, di ba? Potassium in, sodium out. Potassium in, sodium out. Ibig sabihin, normally, ang sodium nasa outside, okay, of the cell. So, na kay sodium ion, normally outside the cell. Diba? Sodium out. So, ang sodium ion, sila yung mga major cations found in the extracellular fluid. Okay, so, na sila sa outside. Mo na siya ang normal condition, okay, sa sodium ion channel. Now, whenever from resting state, yung cell, okay, was stimulated, okay? So, na-stimulate ang cell. Kung mayroon kag na-stimulate, meaning, naa siya na-feel na voltage, na siya na-feel na electric signal, na depolarized ang cell from negative yung inside, from resting negative, naging positive yung inside ng cell, okay? That will open, no, the ion channel ng sodium, okay? Kaya na-stimulate man, it will now allow, no, the sodium ions to enter the cell. So that is the mechanism, no? That is how sodium ion channel works. That is how voltage ion channel works. Mura siya gate, ion channel, okay, that opens transiently whenever naa siya ma-feel na voltage, whenever ma-depolarize ang cell. I repeat, a voltage ion channel, it is an ion channel that opens transiently in response of a voltage, in response of a depolarized cell. Okay? So, ganun din yung mangyayari sa potassium ion channel, calcium ion channel. Kung na siya ma-feel nga changes sa electrical signals, then that's the time it will allow the entry or the outflow of the ions. Okay? So, ito lang yung explanation kung saan akong i-illustrate mo, rapod niya siya. Okay? At a resting potential, negatively charged ang inside ng cell, voltage-gated sodium ion channel are closed. So, magpabilin na nasa labas yung sodium. Okay? Then, kapag ang membrane, cell membrane na depolarize, na stimulate, kapag na-stimulate siya, ibig sabihin highly positive na ngayon yung inside ng cell, there will now be a change, a conformational change. Mag-o-open transiently yung sodium ion gate. Okay, allowing now the entry of sodium ion. Okay, now there are drugs. So ngayon, meron tayong mga drugs that targets voltage-gated ion channel. Okay, so halimbawa, merong drug that blocks sodium ion channel. Ang tawag sa kanila ay sodium ion channel blocker. Okay, di ba natin mga ingana nga drug? Natay drug na calcium ion channel blocker. Katong mga calcium channel blocker. Napod tayong mga drug that are classified as potassium channel blocker. So katong mga drugs that belongs to those categories classification, protein targeting din sila. Particularly, they target a voltage-gated ion channel. So ito yung mga halimbawa. Okay? So sodium channel blockers, halimbawa sa inyong CNS, diba sa CNS drugs, sa PICOL-1, and na ay anesthetics. There are anesthetics, the local anesthetics, yung MOA nila, they block sodium ion channel. Okay, so these are examples of drugs that are protein targeting. They target sodium ion channel. They block the sodium ion channel. Now, under local anesthetics, review lang siya, there are two classification ng local anesthetics. We have based on chemistry, based on their chemical structure. Meron tayong ester type, meron din amide type. Okay? So, for ester type, usually, isa ra ni ilahang letter I, para dali ra ninyo madumduman ba. Ang mga names ng mga local anesthetics under ester type, usually isa lang yung letter I. Example, benzocaine. Okay, halimbawa, benzocaine. Under amide type, usually dalawa yung letter I. Okay, sa ilang names. Usually, hindi lahat, pero mostly, ang names ng mga anesthetics na amide type, dalawa yung letter I. Example, lidocaine. Okay, so ayan. Then there are also some anticonvulsants, nalala, like carbamazepines, phenytoin. Kung inyong i-review ang inyong notes on anticonvulsants under carbamazepines, phenytoin, these are examples of drugs that block sodium ion channel. Then this class 1 antiarrhythmics, we will discuss this under CBD drugs. After the review, after this week, we will start another unit on Monday. So, madiscuss na po ni ang antiarrhythmics under cardiovascular drugs. Alright? Then we have drugs that targets potassium ion channel. So, halimbawa, we have class 3 antiarrhythmics. I repeat, ang mga antiarrhythmics, madiscuss na po ni siya sa cardiovascular drugs. Okay? So, halimbawa, I will just give an example, amiodarone. So, this is a specific example of class 3 antiarrhythmics. And lastly, for potassium channel blockers, we have insulin secretagogues, particularly those with phenylureas. Katong mga start with gly na prefixes with letter I or gly with letter Y. Example, glyburide. Glyburide. Ano pa ba? Glymeteride. Yan. I don't know what's the spelling. I-search na ninyo. Basta ka na. I-search na lang ninyo. Glymeteride na siya. Glymeteride. Okay? Another, glypizide. Basta mga nag-start sa gly, with letter I, gly with letter Y na prefixes. Those are sulfonylureas, insulin secretagogues. Potassium channel blockers sila. And lastly, mga calcium channel blockers, ma-discuss gihapon nato ni siya sa cardiovascular drugs. So I introduced this earlier para somehow inyo ha siyang ma-realize later on na, okay, protein targeting siya. It targets a voltage-gated ion channel. It targets a calcium ion channel. Okay? So, example, ang calcium channel blockers na classify po siya into two based on chemistry. Based on chemical structure, we have dihydropyridines, those ending in dipines, and non-dihydropyridines. Okay? Based on chemistry na siya nga kung ano iyang chemical structure, humana man mo, di ba, og medicinal organic chemistry, so inyo na nang ma-realize, no? Ang classification, daghan ta way to classify drugs, whether by chemical structure, by its MOA, etc. So, ang mga dihydropyridines, yung mga calcium channel blockers na merong dihydropyridines sa kanilang structure, usually to identify their names, katong ending in suffixes na dipine. Example, amlodipine, nifedipine, licardipine, ayun. Those are dihydropyridines. Ang non-dihydropyridines, dalawa lang yan. Please take note, diltiazem and verapamil. Again, how we will discuss this sa cardiovascular drugs that will be next week. Okay, so I repeat, all these drugs on this screen are protein targeting drugs then, particularly they target voltage-gated ion channel. These are cell membrane proteins with specific binding sites and they undergo conformational change. A very good example of a carrier molecule is sodium potassium ATPase pump. So what would be the function of this carrier molecule? The function of sodium potassium ATPase pump is for the extrusion of calcium ion from the cardiac myocytes. Okay, I repeat, this is very important for the extrusion of calcium ion from the cardiac muscle cell. Okay, let me illustrate to you the function of sodium potassium ATPase pump for better understanding. So sabi, this is a carrier molecule. A carrier molecule is a cell membrane protein. So this is embedded in a cell membrane. So let's say, for example, this is a cell membrane. Okay, that is a cell membrane. This would be the sodium, okay, potassium, okay, ATPase pump. Ayan, example lang. Now, sodium potassium ATPase pump work along with NCX. Okay, what is NCX? NCX means sodium calcium exchanger. Okay, so I repeat, sodium potassium ATPase will work together with the NCX. NCX, please take note na lang ha, sodium calcium ion exchanger. Sodium calcium exchanger. Okay, now initially, what will the sodium potassium ATPase pump will do? Magkakaroon muna ng transport of the sodium ion and the potassium ion. Kaya ngayong tawag is sodium potassium pump. Okay, it is a transport system. So the transport, the ratio of the transport would be 2:3. Ibig sabihin, in every 2 ions of potassium, okay, 2 ions of potassium, there are about 3 ions of sodium, okay, that gets out. In every 2 potassium ions that gets in, 3 sodium ions gets out. Okay, so that is the initial transport happens in sodium potassium ATPase pump. Okay, bakit hindi pantay yung ratio ng transport? It is because the extra 1 sodium ion dyan, it will go back to the cardiac myocyte. Okay, kasi diba we're talking about the cardiac myocyte because this is where the sodium potassium ATP pump is embedded. Okay, so it will go back 1 ion of sodium. Okay, will get in via the NCX, via the sodium calcium exchanger. Okay, so as sodium gets in, okay, it will get in exchange of calcium ion. Okay, so that's how sodium potassium ATPase pump work. Kaya nga yung end result, there is extrusion of calcium, di ba? Tingnan yung end result. There is extrusion of calcium, palabas ng cardiac myocyte, yung calcium ion. Okay? The sodium potassium ATPase pump, there is transport, initial transport of sodium potassium ion. Then 1 extra ion of sodium will get in, okay, will go back inside the cardiac myocyte in exchange of calcium ion. Okay, so very important siya for extrusion of calcium ion from cardiac myocyte. Now, this condition is actually normal, no? A normal function of our cardiac myocyte, okay, in relation to this pump. However, there are conditions, there are cases wherein this function of sodium potassium ATPase pump cannot be tolerated, especially for those patients with heart failure. Okay? I repeat, yung pagkakaroon ng calcium ion being extruded, okay, from the inside of the cardiac myocyte, that is not good to patients with heart failure. Kasi, di ba yung rationale, heart failure, so yung heart fails to contract. The heart fails to pump blood. Sobrang hina ng puso to contract. Okay? So that's a problem with heart failure. Now, ano ba yung ion na very important for muscle contraction? Ano ba yung ion na very important for muscle contraction? Very good.
Calcium,
It's the calcium ion. Very good. Now look at the normal function of sodium potassium ATPase pump. Where does the calcium ion goes? Diba? Outside of the cell. The calcium ion is being extruded. Therefore, we cannot let this condition be for patients with heart failure. Tama? Kasi palabas yung calcium ion. Supposedly, kailangan natin i-accumulate yung calcium ion inside the cardiac myocyte para somehow mayroong muscle contraction, muscular contraction. Dito papasok yung example ng drug that targets this carrier molecule. Digoxin. I know you're familiar with digoxin. This is a cardiac glycoside. This is a cardiac glycoside. Yung mechanism of action niya, it inhibits the action of sodium potassium ATPase. So yan, yung MOA niya. So tingnan, if we inhibit, ayan, inhibited yung sodium potassium ATPase. Therefore, there will be no initial transport of sodium and potassium ion. Walang lalabas, tama, na sodium, walang papasok na sodium, tama, sa NCX. Therefore, ma-accumulate yung calcium ion inside. Kasi pigil man yung function ng sodium potassium ATPase pump. So that is how digoxin works. It inhibits the sodium potassium ATPase pump. So pigil, kumbaga yung extrusion ng calcium ion. So very good ni siya for the management of heart failure because with that MOA, okay, it can increase the contraction of the heart kasi nga accumulated ngayon yung calcium ion inside the heart. So isa siyang inotropic agent. Inotropic, di ba? This is a medical term to describe the strength, okay, or the force of heart's contraction. Okay? So, inotropic, okay, agent yung digoxin. Okay? So, that's one example of a drug that targets a carrier molecule, particularly sodium potassium ATP. Sige, another example of a carrier molecule. I repeat, another example. We have, the proton pump. Proton pump is also known as potassium hydrogen ion pump. Again we're talking about the carrier molecule muna. I know ang nasa inyong mind is the PPI, the proton pump inhibitor. That will be the drug later on. So let's have first the normal function of proton pump. Okay? The normal function of proton pump is that this is important to mediate the release of acetylcholine, gastrin, and histamine. These endogenous substances, these are very important for HCl secretion. Again, these are very important endogenous compounds for the release of or secretion ng hydrochloric acid. Ibig sabihin, kapag present ito, most probably taas yung HCl, okay, sa stomach. Now, there are conditions, tama, na hindi nila kayang i-tolerate yung pagtaas ng hydrochloric acid. Halimbawa, for patients with ulcer, for patients with hyperacidity. That is why we have to manage that hyperacidity, okay, environment ng stomach. Okay? So dito papasok yung drug that will target proton pump. And those are the proton pump inhibitors. Okay? So madali lang natin ma-identify by names yung mga PPIs, those ending in prazoles. Okay? Halimbawa, omeprazole, pantoprazole, lansoprazole, esomeprazole, ayun. Except aripiprazole. Okay? Ito lang yung exception Bakit? Ano yung classification ng aripiprazole in your PCOL 1? Ano yung classification? Very good. It is an antipsychotic. Okay? So yung PPI inhibitors, yung PPI or proton pump inhibitors, yung MOA nila is based on the term itself. They inhibit proton pump. So upon inhibition of proton pump, pigil yung release ng tatlo. Pigil yung release ng acetylcholine, yung gastrin, tsaka histamine. That is why this is considered the most effective agent for hyperacidity. In fact, this is the first line in treating ulcer, peptic ulcer disease, PPI. Okay? Although there are other drugs, there are other agents that helps manage hyperacidity, halimbawa, ranitidine. Di ba? Ranitidine or what are other drugs na same ang classification with ranitidine. Di ba? We have famotidine. Famotidine, this is present in the drug Kreml S Advance, yung kulay blue. Di ba? Doon man nakaklase ang Kreml S. Meron tayong kulay pink, yung plain. Yung Advance is kulay blue. Now, if you try to check the generic name, you can search that. Okay, open mo tab. You can search that. Famotidine is present no, a component of Kreml S Advance. And that is a histamine 2 blocker. Same with ranitidine. So via blocking histamine, okay, they only inhibit the release of one endogenous substance, okay, that mediates the secretion of HCl, and that is histamine. Okay? So, meron pang other agents, di ba? Other agents like acetylcholine, gastrin, that mediates HCl secretion. So, comparing that action to the PPIs like omeprazole, we can really say that most effective yung mga PPI kasi it doesn't inhibit only the release of histamine, but all these endogenous compounds, acetylcholine, gastrin, and the histamine itself. Okay, so most effective siya for hyperacidity. Okay, so PPIs are examples of drugs that are protein targeting. They target a carrier molecule, proton pump. Okay, so we're done with carrier molecules. Okay, let us proceed to the third type of regulatory protein. We have the enzymes. Enzymes in your biochemistry, these are classified as biological catalysts. Okay, they are very important for the chemical reaction to occur. So a good example of enzymes, we have phospholipase A, 2, the COX cyclooxygenase 5 lipooxygenase. Now, these three enzymes, madali lang man ma-identify yung enzyme no kasi ending in ACE. Okay? Now, these three enzymes, these are very important. No? They contribute to the arachidonic acid pathway. If you're familiar with AA pathway, or specifically sa metabolism production ng PPI. Okay, these are very important enzymes. Again, these are very important enzymes, particularly in the production and metabolism of arachidonic acid, particularly phospholipase A2. This converts the major source of arachidonic acid to arachidonic itself. Okay, so phospholipids will be converted to arachidonic acid via the enzyme PLA2. Okay, so that's the function of the enzyme PLA2. Now, arachidonic acid as a fatty acid, this generally undergoes a enzymatical metabolism. Okay? And two-way yung metabolism ng arachidonic acid to produce the eicosanoids. Okay? So we have the COX, okay, pathway, okay, which produces prostaglandins. And for the 5-LOX pathway, it produces the leukotriene. Okay, these are eicosanoids. Kasi eicosatetraenoic acid, diba, yung chemical name ng arachidonic acid, unsaturated fatty acid. So yung product niya, metabolites are known as eicosanoids. This is just review ha. Review rin siya sa inyong people 1. Now, under COX pathway, I've mentioned it produces prostaglandin. Now, talking about prostaglandin in our body, there are a lot of types, diba? Depending sa letter PGE, alpha, PGE, PGD, ayan. Okay? So, yung prostaglandin, meron tayong mga prostaglandin sa body natin na very important for cell activity, for normal cell activity, and very good, okay, that contributes to our well-being, okay? And there are also prostaglandin that produces in the setting of pain and inflammation. So those are few of the contribution of prostaglandin once present, no, in the body. With regards to what I've mentioned, na prostaglandin very important for the normal cell activity, I am talking about the action niya towards the stomach lining, the cytoprotection effect. Cytoprotection, ibig sabihin, those prostaglandins that are very important to thicken the lining of stomach. The lining of stomach. Okay? So na ay very important prostaglandin, very important for vasodilation, for cytoprotection. Cytoprotection, importante din kayo na ha, to thicken the lining of the stomach to prevent it from the acidic environment ng stomach. Now, meron din mga prostaglandin that releases in the setting of pain and inflammation. Now, with regards to leukotriene naman, leukotriene, so leukotriene naman, when present, when released, yung action naman niya is more on the bronchial smooth muscle and it causes bronchoconstriction. Okay? So dito papasok ngayon yung mga drugs kasi pain and inflammation must be managed. Tama? Pain and inflammation, there are drugs that help manage pain, help manage inflammation. And during for those patients with asthma, di ba? Pag ang patient may asthma, Yeah. What happens to his or her lungs? Constricted na yung bronchioles. Okay? So yung presence of leukotriene or production of leukotriene, it can worsen, di ba? The condition of an asthmatic patient. Kasi nga, constricted na yung bronchus niya, tapos may production pa ng leukotriene that could worsen his or her state. So, di rin mo sulod ang mga drugs. Okay, let's have, for instance, drugs that help manage inflammation. Diba? We have NSAIDs. Itong mga anti-inflammatory ba? We have the non-steroidal anti-inflammatory drugs. Okay, ano ba yung MOA ng NSAID? They inhibit the enzyme COX. Okay, so ayan. Again, they inhibit the enzyme COX. So therefore, if inhibited yung pathway na yan, wala nang mapoproduce na prostaglandin. Okay? I repeat, with the MOA of NSAIDs, okay, upon inhibition of COX enzyme, okay, wala nang release or production of prostaglandin. Okay? So, it really helps manage inflammation and pain. However, this is the cons, okay, with the MOA of NSAID. Diba? I have mentioned there are prostaglandin very important for normal cell activity. Paano na lang yung cytoprotective activity ng mga prostaglandin? Diba? Okay, so given that idea na si NSAIDs, it can block COX, as in all prostaglandins in the body, okay, affected yun. Even those prostaglandins that are good enough to help our normal cell activity. Okay? So karon, di ba, kapag cytoprotection, siya yung nag-help to thicken the lining of the stomach. So kung wala na yung mga prostaglandin na yun, NSAID might be delikado siya, no? If makataka-rakag, administer. Okay? Kung dili proper yung administration ng NSAID. Kaya nga, di ba, kung hindi proper yung administration ng NSAID, na ay mga case, you can search on the internet, na atay daghan cases ng ulcer because of NSAIDs. Yun yung mga tinatawag na NSAID induced na ulcer. Okay? Or drug-induced ulcer. So, yung drug na yun, NSAIDs. Okay? Kasi nga, that is because of its MOA. Okay? Na-inhibit niya yung prostaglandin na important sa stomach lining. Okay? So, what would be the recommended time? Okay? Or not time, recommended administration, proper administration for NSAIDs like mefenamic acids, ibuprofen, very good. It should be taken after meal. Okay, it should be taken after meal. Kaundaan para somehow na ay mag-protect sa lining sa inyong stomach. Then, take og NSAID. So, yan for NSAID. Then, we also have other drug, okay, that targets naman the enzyme 5-LOX. Okay, so this is an anti-asthma naman. Kasi nga, upon inhibiting the enzyme 5-LOX, pigil yung production ng leukotriene. Ayan. Okay, di ba? Pigil yung production ng leukotriene, so alleviated yung constriction ng bronchioles. So somehow, meron siyang anti-asthmatic activity. Okay, anti-asthma. And we also have drugs that targets phospholipase A2, the steroids. Example, prednisone. Okay? Now, since nasa taas siya ng pathway, di ba? Kung inhibited yung PLA2, wala na yung PLA2, therefore, hindi mabubuo yung arachidonic acid. So, walang COX, walang 5-LOX. Kaya, there are, most of the steroids have this anti-asthma, anti-inflammatory activity as well. Okay, so again, these are the example of drugs that targets enzymes. Diba? Enzyme, again, is a regulatory protein. Okay, let's have another enzymes. Okay, monoamine oxidase. You have encountered this sa CNS drugs. Diba? Sige. So monoamine oxidase or MAO, there are actually two types. Diba? We have MAO-A and MAO-B. Okay. Now, presence of this this enzymes, monoamine oxidase, this causes metabolism of endogenous compounds like norepi, epi, serotonin, histamine, tyramine. Okay? Kapag present yung MAO-A. For MAO-B, very important naman yung MAO-B for the metabolism of dopamine. Okay, I will highlight the term metabolism. Kapag metabolism, dapat ang naagad sa inyong mind is we are degrading, we are deactivating that particular substance. So kung atong gi-deactivate, gi-degrade, okay, gi-convert into excretable form ang kana nga substance, that will lead to lowering, no? Lowered yung level ana nga substance. Okay? So, kumbaga, kapag present si MAO-A, bababa yung level ng halimbawa serotonin. Kasi it metabolizes man serotonin. This is serotonin ha, 5-HT. Okay? 5-hydroxytryptamine yan. MAO-B naman, kapag present siya, okay, lowered yung kapag grabe yung sobrang dami ng enzyme ng MAO-B, that really, okay, causes lowering of dopamine levels. Ngayon, there are conditions, okay, cases na the lowering of this, okay, lowered level of this endogenous compounds like serotonin, dopamine, it can worsen, okay, diseases. For example, patients with Parkinson's disease, okay? Patients with Parkinson's disease, di ba yung one of the underlying cause is mababa normally yung dopamine level. Yan yung isa sa mga underlying cause bakit may Parkinson's disease. Kaya affected yung mobility ng tao. Okay, mababa na. Therefore, with the action of MAO-B, okay, which lowers the level of dopamine, that could worsen, no? That could worsen the patient with Parkinson's disease. Okay, another example na hindi tolerated, okay, yung presence ng mga enzyme na to would be for patient with depression. Okay? So kapag may depression, ang tao normally, okay, by theory, mababa naturally yung serotonin levels. Okay, mababa yung serotonin levels. Therefore, kapag present yung MAO-A, which lowers, okay, di ba, gina-metabolize niya, halimbawa, yung serotonin, so baba yung serotonin level, it could worsen, no? The depression state ng patient. Okay? So dito papasok yung gamot, okay? Yung mga inhibitors of MAO, inhibitors of these enzymes, monoamine oxidase. Okay? So under monoamine oxidase inhibitors, there are three types. Okay? We have non-selective MAO-I. Non-selective, ibig sabihin hindi siya maarte. Pwede siya inhibit of MAO-A. Kaya din niyang i-inhibit yung MAO-B. Okay? So example, we have tranylcypromine, isocarboxazid, and phenelzine. Okay? For a selective MAO-A inhibitor, we have the common example moclobemide, and for selective MAO-B inhibitor, we have selegiline. Okay? Again, these are inhibitors of MAO, monoamine oxidase. So they could inhibit, kapag non-selective, they could inhibit MAO-A or MAO-B. Okay? Kapag selective, depende kung anong receptor yung kaya niyang i-inhibit. So upon inhibition of MAO-A, pigil yung metabolism. Kapag pigil yung metabolism, what will happen to the level of this endogenous compounds, taas or baba? Kapag pigil ang metabolism, what will happen to the level of these endogenous compounds, taas or baba? Okay, it is ano? Okay, taas. Okay, very good. Increased. Okay? Increased yung level. Okay? Sige. So these are examples no, of drugs that targets the enzyme MAO, okay, MAO, monoamine oxidase. Okay? So in general, these are protein targeting as well. Kasi enzyme is a regulatory protein. So protein targeting po sila. Now, I have a follow-up question. Between moclobemide and selegiline, again, between moclobemide and selegiline, which has a useful action towards Parkinson's disease, which has a useful action towards Parkinson's disease. It is, dugay kung maka-receive og kuan response. Ayan, very good. That is selegiline. Kasi it selectively block MAO-B because it selectively block MAO-B. Very good. So the other way around, yung moclobemide, this is very useful for treating depression. Okay? And kapag tinanong between phenelzine and selegiline, which has useful action towards Parkinson's and depression. Meron siyang useful action, very good, it's phenelzine. Kasi nga, non-selective monoamine oxidase inhibitor yung phenelzine. Sana lang ha. So we are done with the first 3 types of regulatory proteins and those drugs that targets, okay, this protein. So categorize sila as protein targeting.